think you know it's the longest lasting, most severe epidemic of Ebola that has ever occurred. It's now been going on for over a year. It probably started in Guinea, at least in December of 2013. It's the first time that we've seen several countries affected at the same time, affecting both the capital cities as well as rural areas. It's the first time we've seen Ebola exported out of the African continent into Europe and North America. It's the first time we've seen transmission of Ebola outside of Africa, healthcare workers having gotten infected in Spain and in the United States. This actually is a historical event. As you know, there have been about 20,000 cases and about 8,000 deaths. Sierra Leone is now the country with the greatest number of cases, then Liberia, then Guinea. There will be opportunity and need to discuss, to analyze, how did this happen? How did this happen? With all of the resources we have, all of the surveillance systems, the World Health Organization, the UN, all these international organizations, CDC and others, what exactly happened? That will be for later. So the focus really now is to try and contain and control this epidemic. The current situation is very different in the three countries. Sierra Leone is now the most heavily affected. In Liberia, things are remarkably different. This last visit I made, from when I was there in July to August. I think Sierra Leone and Freetown are now where Monrovia and Liberia were back in July, August, when growth of the epidemic was exponential. It was doubling, the numbers of cases were doubling about every 2 to 3 weeks. Liberia now is on the decline, and the number of reported cases, confirmed, laboratory confirmed cases nationwide, is now only about 5 or slightly less. And what we're seeing is Monrovia with sporadic cases around the city, and then clusters, outbreaks around the country in very, very remote areas sometimes, mostly seeded by somebody traveling from Monrovia and then initiating a separate cluster. Science has to be the basis of this response. Science is the basis of public health. Science and data. Whatever you're doing, laboratory, treating patients, caring for patients, epidemiology, whatever administration, it's all necessary. It's all necessary.